All right, Bob, hip pain. Is it arthritis or bursitis? We're going to show you how to test for it and how to treat it all at home.
Very good.
Bob and Brad, the two most famous physical therapists on the internet.
Hip arthritis or is it bursitis?
Bursitis,
Pain
right.
in the hip. So we're looking at Sam. He's going to help us out today. Here is the hip, the ball of the hip, and here is the greater trochanter. Now, arthritis comes from
The joint itself.
exactly the
Ball and socket glenoid.
right, the cartilage becomes rough and irritated, and movement and weight bearing increases pain.
Right.
A big distinctive difference is bursitis is more specifically out on this part of the bone, which is right here. You can feel
There's a
that.
fluid-filled sac that is over the top of the bony prominence here.
Which is a bursa.
Right.
And itis means inflamed, so that bursa is inflamed. And every patient I've ever had that had bursitis of the hip, I'll go and I'll find that bone, and then I'll rub on it, and within a half a second, they're letting me know in a painful way. Ouch, that hurts right there.
By the way, Brad, I call this the glenoid fossa. The glenoid is up here.
Yeah.
This is the acetabular.
There you go. I'm glad you caught that, Bob, because there are going to be people out there.
They'll
Chime
catch
in
it,
and they'll
yeah.
holler at us for that, trying to catch us on every move. So again, the symptoms are very similar. When you walk or weight bearing, they both hurt your hip, but bursitis has that distinct tenderness over that bone.
Right.
So we're going to tell you how to treat that specific diagnosis first. Here we go. The first thing with bursitis, painful when you walk. People don't want to do this, but get a cane out. It's not a long-term thing. It's only until this bursitis
not permanent.
settles down. Yes. So pain is here. Take the cane on the opposite side. If you put your arm down, the handle will go to the wrist, the crease of the wrist, and you walk, and each time you walk, the cane goes with the sore hip, takes pressure off of it, and will decrease pain. Again, you'll only do that for a few days, get the pressure off. While you're using the cane, not exactly the same time, but during that day, you're going to lie
You can
down.
also use a cold pack
Right.
and put it right on the hip itself. Now you can buy one or you can make one. We have a video on how to do that.
Right.
You can also use an NSAID or ibuprofen.
Right.
Something that actually calms it down. Next, you're also going to do non-weight bearing exercises like, well, let me show you.
Yeah.
Sideline hip abduction.
So now this exercise is working the muscles around that hip bursa, allowing you to strengthen these muscles without irritating it.
Now, if it does irritate it, don't do it.
Right.
Next one is clamshell. You actually put your knees together, your ankles together, and you're going to work on opening the clamshell.
Yep. Open and close. And do it slow like this. Take your time, 10 to 15, or until you feel the fatigue in the hip muscle. The next thing, by the time you've done this for a few days, cold pack, use a cane, you'll start feeling like, I don't know if I need the cane anymore. Then progressively start walking without it. Continue the cold packs 2 or 3 times a day. Continue the
Do it slowly,
strengthening
though.
exercises.
Yeah.
And progress through the walking as tolerated. Don't overdo it. Now we're going to get into arthritis of the hip. Okay, arthritis of the hip. You know, you might find some crepitus when you walk or move. That's that grinding of the hip. That's even a more clear sign that you got some arthritis in there. To treat it, again, get the cane out if it hurts when you walk. If that right hip hurts, the left cane, just like we just talked about, the same thing as bursitis.
It's really going to help.
Right, exactly. The other big difference with arthritis, in my clinical experience, I think Bob's agree, you can use either a cold pack
Or heat.
whatever you respond
Some
better to.
fashion, right? So a cold pack, again, you can put it right on the hip itself. You can go for 20 minutes, do it a couple of times a day. For heat, we like to use far infrared heat. It's actually from Thermotex. This does a great job. And Brad, how far does this heat actually penetrate?
Right. The big difference between a regular heat pad and the far infrared is normal heat pad goes about 2 or 3 millimeters skin deep. This
Right.
goes 2.36 inches. It gets down into that hip joint.
Yeah, it goes into the joint itself.
Absolutely.
All right, we have a whole bunch of stretches we can do to the hip. We'll try first single knee to chest, Brad. You can do it seated.
Yep.
I can do it supine or lying on my back, laying in my back, lying in my back.
There. This actually gets the knee as well, so it's kind of a two for the effort of one. 2 joints.
All right. How
Next.
about a figure 4?
Yep.
I'm going to actually take my ankle, cross it over my knee, and actually push down a little bit. I could actively do it too. Push down with the leg.
Do the exact same stretch
I
in
can
the
also
seated
bring
position.
the leg up like this, and I can even go further and go like this.
And if you're seated, you can do the same thing, or you can lean forward like this, push down like
You can even
this.
grab the foot and give it a little yank.
Yeah. You'll know. You want these stretches to feel like a good stretch, not creating any sharp pain at all. Make sure you do both legs as well, even the one that feels good. Make sure you get that
Anything
one.
else, Brad?
Well, Bob, we want to move on to the next exciting. Next thing is we want to get the soft tissue. In other words, the muscles around that hip joint. We want to get those softened up and relaxed, increase blood flow. A massage gun really works well for this. I actually had this with a patient in the last year. He's going to get a hip replacement. And for about 2 to 3 months prior to the hip replacement, he would use the massage gun and work the muscles. You don't go over the hip joint itself. You work the muscles around, usually the ones on the back side, on the butt area there. But you can work over the top. There's muscles there and in front.
And down into the thigh.
Yep, exactly.
Make a big difference.
Probably like the ball one, the ball head. There's
Right.
6 heads with this particular one. This is our Bob and Brad gun, which we were really excited about.
By the way, yeah, we're releasing it at Walmart.
They're excellent quality. You will not find anything wrong with it. And I really like it. This has been great. This particular patient, his hip is replaced now, but he really found this beneficial.
So we'll have a list of stores where it's being released at and the link below.
Right.
Because there's 500 Walmart stores.
Right. And, we also have our guns online as well. But, if you like to do the old-fashioned shopping, it's the way to go. All right. Next thing, Bob, strengthening exercises.
Sure. All right. We're going to strengthen the left hip, the one that's on the top. So I'm going to go ahead and keep the leg straight. This lower leg is bent, provides kind of a base for doing the exercise. And I slowly bring it up and I slowly bring it down.
10 to 15 reps is probably
Right.
adequate.
Then you could try a few clamshells where you actually line up the ankle, line up the knee, and it looks like a clam, doesn't it?
Right,
Brad?
open and close there.
Right.
If
That's
you're-
right.
There you go. Again, 10 to 15 of those as well. You should probably do both sides.
And this is a good time to mention that you should not sleep on a painful hip.
Right, exactly. I do want to show standing exercises briefly. It's easy. If this is my sore hip, I'm going to do hip flexion like this, 10 to 15 reps. Hold on to a back of a chair, to a cupboard, something solid and safe. Go out to the side like this. Make sure you don't point your toe this way, but this way, straight ahead. 10 to 15 of those. And then straight behind you, not like this. Don't let the knee bend. Straight leg, and that'll get that hip muscle, hip joint more effectively. 10 to 15 of those, and then you'll want to sit down and rest.
Right. The stronger the hip, the less pain you'll have.
Absolutely. Motion is lotion. So enjoy this video. And Bob, I think we should carry on with some kind of famous ending.
We can fix just about anything but
Except for a
broken heart
broken heart. Yeah, we're working on that too.
for a long time.
Yeah, we don't get very far.